Hi, I'm Talia, and my proprietary style of yoga called Turbo Dog Yoga is designed specifically for people 35 and older who are active and want to stay active and want to stay injury free and want to age gracefully and vibrantly. And so I want to talk to you today about abdominal separation and how you can test yourself to see if you have it and why that's even important to do. So let's just talk a second. There are three layers to the abdominals. There's the transverse abdominals, which is the deepest abdominal layer, and that goes like a girdle around your body. Then there is the obliques, which go on the sides on a diagonal like that, and then you have your six pack. So the six packs, right, have between them this connective tissue called the linea alba, and that gets compromised, and that's when you have abdominal separation. And usually that happens because so a lot of times, right, our shoes, most of shoes that are non-barefoot shoes have heels and they push the hips forward. Also, a lot of times people stand with their hips forward, and that places a lot of pressure on the linea alba or the tilt of the pelvis, right, especially when you're pregnant. That kind of forward pressure on the linea alba causes it to separate. And when that happens, then you always have like a flabby belly, right? Your belly can never be like really straight, and your core is typically compromised. And a lot of people will tell you that it can't heal and that you're stuck with it forever. And I'm here to tell you that that's not true. You just have to know how to strengthen your transverse abdominals in order to kind of bring everything back together. But so, how do you know if you have it so that you know if you need to do certain modifications in your practice or in your life in order to heal it? So, the way you test for it is you lay on your back, your feet flat on the floor, and then you do a little sit up like that. And when you do that sit up, right, you look at your abdominals and you can see that they get engaged. And then you start to feel, I'm going to show you along the midline here. Okay, and you're feeling kind of back and forth like that. And what you're feeling for, is it like nice and hard the whole way down, or is there like this kind of a ridge where then your fingers kind of fall down into a valley, a soft valley, and then another ridge on the other side? So if you have this ridge and then like this valley, that's abdominal separation. And then the key is that you have to stop doing things that stress your linea alba until your abdominal separation is small enough to continue to heal on its own. So what is that? That is when it is one finger wide, right? So the ridge is no more than one finger wide. It's no more than one finger long, and it's no more than maybe like half a nail deep. Okay, and once you have it back to that state, you can go back to completely normal activity. And I teach a bunch of modifications in my classes. I routinely offer modifications to help heal it. And it'll typically take about a year, but you need to be working with someone who knows what they're doing. So if this sounds interesting to you, you're welcome to click on the link below, and then you can learn more about the weekly recorded classes that I offer so you can practice regularly with me. All right, so that's it for today, and I'll see you next time.